Hello nurses and hello top notchers, welcome back again to our YouTube channel at welcome na naman po sa ating panibagong common board questions na pag-uusapan. So ang pag-uusapan po natin ngayong araw na ito ay about sa ating mode of transmission of your diseases at ito po ay lumalabas sa ating actual board exam. Okay, so let's begin our topic with situation. Patient safety remains a global healthcare challenge. There are basic principles of infection control. These include standard precautions and transmission-based precautions. The following are transmission-based precaution questions. So, question number 1. Which one of the following is considered the most important intervention in infection control? A. Personal protective clothing. B. Prevention of infection associated with catheter. C. Safe use and disposal of sharps. Or D. Hand hygiene of healthcare staff. So, take note, ang tinatanong po dito is the most important intervention in infection control. So, although yung letter A natin, yung personal protective clothing, ay importante din po yan to prevent your infection, hindi po yan yung pinaka-most important. Okay? Also with your letter B and letter C. Okay? So, ang hinahanap po natin ay yung most important intervention for infection control. And, alam naman po natin that hand washing. So, hand washing or hand hygiene is the single most and cost-effective or cheapest way to prevent the spread of your infectious microorganism. So, ang sagot po natin dito sa ating question number 1, wala pa rin tatalo kay hand washing pagdating po sa ating infection control. So, letter dog is the correct answer here. So, letter D is the correct answer. So, always remember that the hands of your healthcare workers plays a critical role in keeping patients safe. So, if healthcare workers do not clean their hands at the right moments using the proper methods of hand washing, they can transmit infection-causing microorganism through their hands from one patient to another. So, performing hand hygiene at key moments is an important healthcare intervention to prevent the spread of your microorganism. So, always remember that your hand hygiene will reduce the transmission of microorganism and it increases the patient's safety while decreasing your healthcare associated infection. So, always remember lamang itong ating mnemonics kapag ang pinag-usapan natin ay hand washing. So, always remember your wash mnemonics. Okay? So, for letter W, W stands for your wash your hands with soap and water for at least 40 to 60 seconds throughout your hand washing procedure na po yun. So, a minimum of 10 to 15 seconds with an average of 20 seconds yung ating paghuhugas each hands. So, for the hand washing or the whole procedure of hand washing will consume 40 to 60 seconds for the best time of hand washing. So, pag tinanong ka naman sa board exam about the best time of hand washing, it should be 40 to 60 seconds. Kasi mas matagal na paghuhugas, mas maganda po yan. Okay? So, letter A, always apply friction. Why? Because friction is the most important element of your hand washing. So, bakit kailangan mo ng friction? Because friction motion will help to pull dirt and greasy or oil soils free from the skin. So, nakakatulong po ito para matanggal po yung mga dumi na nakadikit po sa ating balat. Okay? So, pag sinabi po nating friction, it is the rubbing together of your hands. Okay? Then, we have also your soap quantity. So, ang soap quantity po natin is nasa 1 to 3 ml po ang binibigay natin. Pero, mas the best po pag gumamit po tayo ng 3 ml of liquid soap. Okay? Then, lather your soap for 20 seconds. So, pag tanongin ka sa board exam kung ilang seconds ka dapat na nag-scrubbing, scrub your hands for at least 20 seconds. Okay? And in case of soap and water is unavailable, we can use, okay, your hand-based sanitizers to cleanse our hands. But make sure to it na meron po siyang at least 60% of ethanol or alcohol. So, at least 60% lamang po ng ethanol content or alcohol yung ating mga hand-based sanitizers natin, okay na po yan para mahugasan po natin ang ating kamay or para malinisan yung ating kamay. Okay? So, yun pong tatandaan natin. Pero hindi po pwedeng gumamit ng hand-based sanitizers if your hands are visibly soiled. Okay? Pag visibly soiled po ang kamay natin, hindi po suggested ang paggamit ng mga hand-based sanitizers. Okay? Then next, question number 2, which mode of infection transmission is due to splashes of blood or body fluids into the mucosa or contamination of non-intact skin with infected blood and body fluids? A. Ingestion, B. Airborne, C. Inoculation, or D. Direct or indirect contact. So, keyword natin dito is, it is a transmission due to splashes of blood into the mucosa or contamination of non-intact skin. So, ano pong tawag natin doon? So, is it ingestion, airborne, inoculation, or contact transmission po yan? So, tanggal na po dyan yung airborne kasi alam naman po natin pag sinabi nating airborne, galing po yan sa hangin. At kapag sinabi naman nating ingestion, galing po yan sa mga pagkain or inumin. So, dadalawa na lamang yung natitira. It's either inoculation or the direct or indirect contact. So, ang indirect or direct contact, ito po yung ating transmission caused by your fingers or your fomites. Okay? So, pag ang microorganism ay transmitted po siya via the hands of the healthcare worker or via fomites, okay? Fomites or the inanimate objects, so that is a direct or indirect contact. So, the correct answer here is inoculation, okay? So, inoculation is the correct answer here. So, if we say inoculation, that is the transmission due to splashes of blood or body fluids into the mucosa or contamination of non-intact skin with infected blood and body fluids, okay? So, ang sagot po natin dyan ay letter C, inoculation. So, pag sinabi po kasi nating inoculation, that is through a break in the skin. Example, kapag ikaw ay nakikipag-sex, okay? So, lahat po ng mga sexually transmitted infection like your HIV or AIDS, trichomoniasis, gonorrhea, chlamydia, at mga iba't iba pang klase ng mga STI or venereal diseases, that is an example of your inoculation transmission. Another form is your animal bites. Example, yung mga rabies infection natin from your dog bites, so that is an inoculation transmission. And through a puncture wound or sharing needles like in your septicemia. Okay? So, pag nagkaroon po tayo ng puncture wounds or sharing of needles and nagkaroon ka ng septicemia condition, that is through your inoculation transmission. At pag sinabi naman po nating ingestion transmission, ingestion is taking in contaminated food or drink or transferring your pathogens to the mouth from the hands of that person. Okay? So, hands to mouth is ingestion. Example natin dyan ay yung mga diarrheal diseases natin like your amoebiasis, dysentery, giardiasis, at yung salmonellosis natin and other diarrheal diseases. So, yun po yung mga examples natin ng ingestion transmission diseases. At pag sinabi naman po nating airborne transmission diseases, airborne is the mode of transmission that involves droplet nuclei or dust particles containing an infectious microorganism that can remain suspended into the air for long periods of time. So, ang pagkakaiba po ng ating droplet nuclei kay droplet particles sa droplet transmission is the size of your droplet. So, pag sinabi mong airborne, it is less than 5 microns. Okay? So, pag less than 5 microns po yung ating droplet, that is a droplet nuclei and that transmission is airborne. Okay? Airborne po yun. And always remember, meron po itong kakayahan na ito ay sumakay sa mga dust particles sa hangin at ito'y lumilipad-lipad lamang po sa hangin and it can remain suspended into the air for a long period of time. Kasi yun yung pagkakaiba pa nila ni droplets. Si airborne kaya po niyang masuspend for a long period of time into the air while your droplet is not. Okay? So ano po ba yung mga examples natin ng ating airborne diseases? So airborne diseases, we have your measles or the rubiola, the Cox disease or the tuberculosis, and your varicella or chickenpox. Okay? So yun po yung mga best example natin ng ating airborne transmission diseases. And itong mga airborne transmission diseases natin, it requires your negative pressure rooms or yung tinatawag natin na negative pressure isolation rooms with a minimum of 12 air changes. Okay? So, dati 6 to 12 air exchanges po ang ating requirement dyan. So, ngayon, pwede na pong minimum of 12 air exchanges kapag ito po ay airborne transmission diseases. And pag sinabi naman po natin direct or indirect contact, it is a mode of transmission of your agent being transferred to other patients from contaminated equipments and via the hands of your health worker. Okay? So, pag ito ay na-transfer or na-transmit po yan via your inanimate objects or tinatawag natin na fomites, okay? And the hands of the nurse or the health worker, that is an indirect or the direct transmission diseases. And last, we have your droplet precautions. So, droplet precautions are used for disease that are spread by droplets in the air, and always remember that droplets are body fluids. So, droplets normally do not travel more than 3 feet, but in influenza and coronaviruses and the smallpox virus, na which is wala naman ng smallpox ngayon, so it can travel for more than 3 feet. So, kaya po nilang trumavel hanggang 6 feet. So, droplets are body fluids, more than 5 microns po yan. So, droplets do not remain into the air or it do not remain suspended into the air for very long, and it seldomly travel more than 3 feet. So, keyword mo yan. So, it seldom travel more than 3 feet, that is a droplet transmission. Yun yung keyword mo. Pag di na po niya kaya mag-travel na more than 3 feet, that is a droplet transmission. Unlike yung smallpox, yung ating influenza at saka yung coronavirus, they can travel up to 6 feet. Pero yung ibang sakit na droplet ang kanyang transmission, it can only travel up to 3 feet. And they cannot remain suspended for a long period of time into the air. Okay? Unlike airborne na kaya po niyang masuspend into the air for a long period of time. Kay droplet, hindi po. Okay? So, yun po yung ating mga transmission-based precaution diseases. Yan. Or transmission-based precautions. Then next, we have your question number 3. Which mode of infection transmission is due to microorganism being transferred to other patients from contaminated equipments and via the hands of nurses? A. Ingestion, B. Airborne, C. Inoculation, or D. Direct or indirect contact. So, kakatapos lamang po natin yung mga transmission-based precautions natin. So, may napag-usapan po tayo kanina na kapag ang agent o yung microorganism ay na-transfer or na-transmit po siya by means of your contaminated equipments or yung mga fomites na tinatawag natin or via the hands of the health worker, the mode of transmission of that disease is direct or indirect contact. Okay? So, the correct answer here in question number 3 is letter D. It is direct or indirect contact transmission. Kasi it can be transmitted via fomites or mga inanimate objects or via the hands of your healthcare worker. Okay? So, the correct answer here is letter D. We have your direct or indirect contact transmission. So, what are the different types of diseases under your direct or indirect transmission precaution? Okay? So, we have your contact mnemonics. Sa other resources, it is the Mrs. W mnemonics. Sa atin, contact po ang ating gagamitin na mnemonics. So, for letter C, that is your conjunctivitis or your pink eye or any eye diseases. Next, we have also your ORF disease. So, ito po yung sakit na nakukuha natin sa ating mga sheep or goat. And letter N, Neisseria Gonorrhea. So, yung ORF disease, that is a skin disease from sheep or goats. Okay? And letter N, Neisseria Gonorrhea. So, yung gonorrhea, that is a contact transmission disease. And letter T, tetanus wound infection. Letter A, antibiotic resistance like your MRSA or the methicillin-resistant Staphylococcus aureus infection. And letter C, chlamydia and other venereal diseases like your herpes, syphilis, HIV, trichomoniasis, your bacterial vaginosis, at marami pang iba. So, pag sinabi mong venereal diseases, that is your sexually transmitted infection. And letter T, we have your tick bites and other animal bites like your dog bite, yung ating rabies infection. So, yan po yung ating mga contact transmission diseases. So, we have your contact mnemonics. Then next, question number 4. What mode of transmission is due to contaminated food and water being consumed? A. Inoculation. B. Direct or indirect contact. C. Ingestion. Or D. Airborne. So, take note, transmission due to contaminated food or water. So, that is your letter C. So, yan po yung pag-usapan natin kanina. We have your ingestion. Okay? So, ingestion kapag galing po ito sa food and water. Okay? So, letter C is the correct answer here. So, examples of your diseases which are via the ingestion transmission, we have your its mnemonics. E for your Eltor or cholera. So, this is a bacterial infection caused by your Vibrio cholerae or your Vibrio Eltor na pwede makuha po sa maduming tubig or sa pagkain ng ating contaminated oysters. Okay? So, letter A, amoebiasis is a parasitic infection. So, parasitic infection from your water na naman. So, water source po ang ating amoebiasis. So, waterborne disease, amoebiasis, and cholera. Si cholera, bacterial cause, while your amoebiasis is a parasite. Okay? And we have your letter T, the typhoid fever. So, ito po yung lumalabas sa board exam. Huwag pong kakalimutan. Typhoid fever is caused by a Salmonella typhi bacteria. Okay? So, bacteria po yan. And it is an ingestion transmission disease kasi po siya po pwede makuha sa pagkain at sa maduming tubig. And last, we have also your letter S. So, letter S is we have your Salmonellosis and your Shigellosis. So, ito po ay mga ingestion transmission diseases. Then next, question number 5. Which of the following is not standard precaution? A. Respiratory hygiene. B. Injection safety. C. Personal protective equipment. Or D. Hand hygiene. Okay, so ang tanong po dito is, which of the following is not standard precaution? So, pag sinabi po nating standard precaution, syempre, pasok po dyan yung ating hand washing or yung ating hand hygiene. And also with the use of your personal protective equipment or yung PPE natin. So, is it letter A or is it letter B? So, alin po dyan ang sagot ninyo? So, pag sinabi po nating standard precaution, wala ka pong makikita doon na respiratory hygiene. Okay? So, the correct answer here is letter A. So, respiratory hygiene is not a standard precaution. So, yung injection safety, part po yan ng ating standard precaution. Kasi, pag sinabi po nating basic standard precaution for infection control, it composed of number 1, hand hygiene. Number 2, personal protective equipment and clothings. Number 3, safe handling of sharps. And number 4, management of spillage like your blood and body fluids. So, ito lamang po ang laman ng ating standard precaution, your hand hygiene, PPE, safe handling of sharps, and management of your spillage like your blood and body fluids. So, wala po doon yung respiratory hygiene. So, letter A is the correct answer there, okay? So, A po ang sagot natin dyan. Okay, so if we say standard precautions, these are the minimum infection prevention and control practices that must be used at all times for all patients in all situations. So, pag sinabi po nating standard precautions, it is applicable for all types of patients po. Yun yung ating tatandaan dyan. So, standard precautions applies to all patients regardless of the diagnosis or presumed infection status. So, if we say standard precautions, it should be used and applied when you may come in contact with blood or other body fluids, especially secretions and excretions, except sweats. Okay? Regardless of whether or not they contain a visible blood. Okay? So, take note. So, applicable po ang standard precaution to all types of body fluids and your blood except your sweat. So, ibig sabihin po niyan, standard precaution is also applicable to your respiratory droplets, your urine, and to your feces except to your sweat. Okay? So, that is your standard precaution. So, tandaan nyo po yan kasi baka lumabas po yan sa board exam. Standard precaution is applicable to all types of body fluids except to your sweat. Okay? Then, number 6, pathogens expelled from the respiratory tract through coughing and sneezing are an example of what mode of infection transmission? A. Direct or indirect contact. B. Droplets. C. Ingestion. Or D. Inoculation. Okay? So, napag-usapan naman na po natin kanina yan. So, we have your letter B. Droplets po ang sagot natin dyan. So, always remember that if the pathogenic microorganism or the agent is being expelled from your throat secretion or your nasal discharges by means of sneezing, coughing, talking, so that is more on your droplet transmission, okay? Kasi 'di ba sabi natin kanina, pag sinabi natin direct or indirect contact, it is by means of the hands or fomites, okay? At pag sinabi naman po natin ingestion, that is food and water. And if we say inoculation, inoculation is the mode of transmission where there is a break in the skin. Okay, so example, merong bite from your dog causing your rabies, or meron tayong puncture wounds and penetrations like in your HIV or AIDS. Okay, so wag niyo pong kakalimutan yan. So here is the list for your droplet precaution diseases. Okay, so we have your Spider-Man mnemonics, S for your sepsis, scarlet fever, and your streptococcal pharyngitis or the sore throat. P for pneumonia, parvovirus B19, and pertussis. And I for your influenza, and D for diphtheria. So E for epiglottitis, R for rubella or the German measles, mumps for your parotitis, meningitis, and your mycoplasma. And A for the adenovirus infection or the causative agent of your common colds or the coryza or sipon sa Tagalog. And N for novel coronavirus or the COVID-19, okay? Kasi 'di ba sabi naman ng ating CDC at saka WHO that the primary mode of transmission of COVID-19 is more on respiratory droplets, okay? So yan po ang ating mnemonics para sa ating droplets precaution diseases. We have your Spider-Man mnemonics. Then next, question number 7. What mode of infection transmission is due to contaminated hands being moved to the mouth? A. Direct or indirect contact. B. Airborne. C. Ingestion. Or D. Inoculation. Again, so if the mode of infection transmission is through your contaminated hands being moved to your mouth, that is an ingestion transmission. Okay? So, letter C is the correct answer here. Kasi hindi mo pwedeng isagot yung ating airborne. Kasi pag sinabi natin airborne transmission, the droplet nuclei can be suspended into the air for a long period of time, such as in a case of measles, tuberculosis, and your varicella. So, yun po yung ating airborne naman. Okay? So, the correct answer in your number 7 is more on ingestion. So, like in your its mnemonics, we have your Eltor or cholera, amoebiasis, we have also your typhoid fever, and your Salmonellosis and the Shigellosis. Okay? So, yun po yung mga examples natin ng ating ingestion transmission diseases. Then, next, question number 8. The advantages of alcohol hand rubs for hand hygiene and infection control are except. So, here in question number 8, ang hinahanap na po natin ay yung hindi po advantage of alcohol hand rubs for hand hygiene and infection control. So, letter A, easier on skin than soap and water. B. Rapid hand decontamination between patients. C. Portable and can be taken to point of care. And D. Works well with non-intact skin. Okay, so napaka-obvious po yung sagot natin sa ating question number 8. So always remember that letter A, letter B, and letter C are advantages of your alcohol hand rubs but except letter D. So ang alcohol hand rubs daw works well with non-intact skin. So take note, alcohol hand rubs can be irritating to your non-intact skin like in your open wounds or any part with inflammation and break into the skin, okay? So except letter D is the correct answer here, okay? So works well with non-intact skin daw. Then next, for question number 9, what is the purpose of wearing gloves and gowns? Select all that apply. Number 1, protect the healthcare worker. Number 2, prevent transmission of pathogens. Number 3, reduces hand washing requirements. Or number 4, looks professional and identifies healthcare staff. Okay, so ang tanong po is the purpose of wearing gloves and gowns. So alin po dyan yung purpose, bakit nagsusot ng gloves at gown ang isang health worker? So here in question number 9, technique in taking your select all that apply question, tingnan mo muna yung ating pinaka-negative na pwedeng tanggalin sa ating mga options. Since positive po yung tanong, hanapin mo muna yung pinaka-obvious na mali. Okay? So ang una nating tatanggalin dyan is number 3. Reduces hand washing requirements daw. Okay? So always remember that wearing gloves and gowns does not replace the need to perform proper hand hygiene. So, in your wearing of gloves and gowns, hand hygiene is always performed. So, hand hygiene must be performed both before and after wearing gloves. Okay? So, what are the reason kung bakit kailangan po natin magsuot ng gowns or gloves? So, according to WHO, we wear gloves and gowns to reduce soiling in our hands with blood and body fluids. That is number 1 reason. Okay? So, to prevent your soiling of your health worker hands. And number 2 reason is to reduce the risk of spreading germs or microorganism to our patient, to the environment, and to other healthcare workers. So, in short, it will prevent your cross-contamination of your microorganism. That is to prevent the spread of your infectious microorganism. Okay? So, the correct answer here is 1 and 2 only. So, ito po yung mga purposes natin kung bakit kailangan natin magsuot ng gloves and gowns. Okay? So, 1 and 2 is the correct answer here. Then, last question, number 10. Nurses must wear gloves when select all that apply. Okay? So, number 1, handling sharp or contaminated instruments. Number 2, risk of exposure to blood or body fluids. Number 3, making beds. Number 4, assisting with patient mobility. And number 5, recording vital signs. So, here in question number 10, napaka-obvious po ng sagot natin dito. So, the correct answer here is 1 and 2. So, 3, 4, 5 are inappropriate for your wearing of your gloves. So, nurses are required to wear gloves when handling sharp or contaminated instruments and when there is a risk of exposure to blood or body fluids, but not for making beds, not for assisting with patient mobility, and recording vital signs. Okay? So, the correct answer here is 1 and 2 only. So, always remember that wearing gloves will not replace your hand washing. Okay? So, 1 and 2 is the correct answer here.